came together as a community to create a blueprint for children's mental health. We were funded by the Jesse Ball DuPont Fund. We came together as a community really for the first time to focus specifically on the issues related to children's mental health. We were able to create what we've called the Jacksonville System of Care Initiative, which has, over the last 6 years, transformed our community. It's brought us all together to work on a single track that we've taken through our 6 years of our journey together to transform how we think about children's mental health, how we respond to children's mental health, how we prepare ourselves to care for families, how we've empowered families and youth themselves to be, in fact, in charge of not only our system, but also of their own improvement in health.
We're talking about the chair of United Way, the executives from the hospitals. We're talking about the executives from all of the provider networks. We're talking about the executives from Daniel Memorial or Children's Home Society. We're talking about the ability to bring the coalition of the pediatricians together, the coalition of the medical community together. So you start putting all those pieces together, and they start talking about common problems. And you realize how many different pieces that the various folks are serving, off the same common problem. Now you start getting solutions.
I would say that we have been innovative in pushing the envelope with not only the community, but also with SAMHSA. The out-of-the-box thinking that went into bringing in frameworks, that we had a board of directors that embraced innovation, that we've had a community that is looking at things differently.
LSF Health Systems has had a very unique opportunity to not only be a funder of some of the terrific programs that have sprung up as a result of the system of care and the various initiatives, but we've also been able to carry forward some of the initiatives that the system of care initiated.
We were able to really do some innovative things around serving our youngest children with their social emotional needs, and the partnership is what has put us all together and made that happen for us.
Well, this is the great thing about being on the board and watching all of the different stakeholders participate in the meetings on a monthly basis. Bringing in experts from a national level, like for frameworks, to come in and do research on how to get everyone to speak the same language and describe mental health and the need for it in the community in a positive way.
The three core values of the Jacksonville System of Care are that services for children and families be family-driven, youth-guided, and culturally competent. My role as a children's ombudsperson is to really push that youth-guided piece. And the way that we do that is by ensuring that children are free from discrimination, that their best interests are considered in all decisions that affect them, that the community understands their right to healthy development and survival, and that they have meaningful opportunities to participate and be heard.
So family-driven, youth-guided are two basic values and principles of the Jacksonville System of Care initiative. And so we were asked to kind of lead those and make those happen so that when you are transforming a system of care, especially for children's mental health, you want to make sure that you get the voice of the family and the youth. And so we hired a family coordinator, a family advocate, and a youth coordinator who helped to develop and lead the Federation of Families of Northeast Florida and Youth Move Jacksonville.
The Federation of Families, I'm very proud to say, has 4 seats on the System of Care Board, and the families are very active in voicing their opinions, and they're voicing the strong information that the families have given them at the meetings and when we're in the community.
I had an opportunity to work with Rosemary, who was a very strong individual, and she was able to bring her strength into her family by her culture. They were able to speak 2 different languages, which was brilliant for them, and they was able to introduce it into their school.
The System of Care initiative embraces these core values to where families tell us what they need, and we look at the strengths of this family and how to build upon the strengths.
I had my children in mental health with counseling and therapy. I feel that they, as an organization and as people, respect what we have to say or how we are with our culture. Okay, we're gonna take that in consideration, and this is your family. This is how you need to proceed with your family for your things to work.
We at LSF Health Systems really embrace the cultural and linguistically competent language. We are now including that as a requirement to include that language so that we are comfortable that our providers are also trained and also honoring and moving that initiative forward as well.
We have trained over 5,400 clinicians and child serving practitioners in cultural competency, in family-driven, youth-guided care, in evidence-based treatment practices, and trauma-informed care. And we've certified close to 100 people in trauma-focused cognitive behavioral therapy.
We want providers to really understand that cultural competency is a journey. It's not a destination. And so it's a commitment to lifelong self-examination, to self-critique. It's about understanding implicit and explicit bias. And it's about treating families with honor and respect and making sure that we're meeting their cultural needs. It's really exciting to see that cultural competency isn't just about training, but really integrating culture at all levels of the organization, from governance to leadership to language assistance to continuous quality improvement.
I think that was another lesson that the system of care actually brought to light to the whole community, that we need more qualified individuals, psychiatrists, counselors, psychologists to really do the work that's really targeted towards early learning and really birth to 18.
Look back at how we created the system of care and the concept behind the grant and the ability for really the top leadership, particularly in terms of the providers of services for this community, were able to kind of break out of their own silos and recognize that there was a greater need that could be served by the community by really pooling their minds as much as their assets to in the creation of this board of directors, in the utilization of this grant, and in the ability of, through this grant, really allow the community to move in a much stronger direction over the past 5 or 6 years, and the results have been outstanding.
With countless efforts, the Jacksonville System of Care Initiative has met all of its grant objectives and has provided access to care and services for families in need. Here are the numbers.
What I'm most proud about what we've accomplished is the fact that we've really taken a systems approach. We focus on systems integration, and we recognize these issues as being critical human rights issues, that we've taken a child rights-based approach. We've focused on the principles of health equity and social justice, been able to translate those principles actually into programs that our entire community has been able to rally around.
A lot of people talk about how important mental health is and how much, how important young lives are. But the partnership and this Jacksonville System of Care initiative has really dedicated funding, resources, time to actually make a difference in children's lives in a real meaningful way.
Collaboration.
Empowering.
Innovative.
Not just saying, but doing.
Proven.
Transformative.
Creative.
Great information.
Fundamental.
Synergy.
Inclusion.
Excellent partnership.
I just want to say thank you for them being in my life, for them coming in and helping us, because if it wasn't for them, you know, I don't think that we will be as unified as a family as we are right now. I think that they've helped us a lot. And if it wasn't for them, we might be in a worse place than we are now. We're in a really good place because they have come into my life and they've helped me and my children.